Well, welcome everybody from all around the country and the world. Welcome to Rochester Lifestyle Medicine Institute and IHA's Folletti Institute Lifestyle Medicine Grand Rounds. I'm Dr. Ted Barnett. I am president and founder of Rochester Lifestyle Medicine Institute, and I'm so excited that you're all here. Some of you may know me as Dr. Veggie. So tonight we have our June Lifestyle Medicine Grand Rounds. The case is healthcare over sick care, a patient with persistently high pancreatic enzymes. We'd love it if you'd consider partnering with us to help empower your patients. We have very easy to use online referral forms, which are on our website, and our programs are standardized to help build motivation and competence in a socially supportive, interactive environment. Two of our programs are ACLM certified, our very own 15-day whole food plant-based Jumpstart program down here, and then the LIFT project, which is developed by Dr. Darren Morton in Australia. And if you're interested in collaborating with us, just send an email to collaborate@rocklifemed.org. These are a little more detail on our programs. I just mentioned our Jumpstart program and the LIFT project. We run them on a regular basis. The Jumpstart program runs at least once a month if you have a patient who might benefit. And we also now offer health coaching, which you can check out our website for more details at rochesterlifestylemedicine.org. We have a number of CME credits available that you can learn about if you go to our website for various educational programs that we run, including Jumpstarting Health, the clinician course. So if you decide to go through one of our programs as a participant, like the LIFT project or Jumpstarting Health, you can receive 10 CMEs actually for being a participant in the program. And also, please respect the privacy of the patient who is being presented. Our presenters make every effort to de-identify them and do a pretty good job, but it is possible that somebody might recognize the patient. So we don't want that to happen. Dr. Arunie Malwatta is our case presenter tonight. She's a clinical nutrition physician from Sri Lanka and currently is in a clinical fellowship in clinical nutrition at Rochester Regional Health. She graduated from the University of Rahuna and completed her postgraduate studies at the University of Colombo in Sri Lanka. With 20 years of professional experience, she has worked in various areas, including nutrition management, bariatric surgery, sports nutrition, nutrition counseling, and lifestyle medicine. For the past 7 years, she's been specializing in adult and pediatric obesity. Dr. Malwatta is also a medical educator, teaching undergraduate and postgraduate students at the National Hospital of Sri Lanka. Currently, she teaches sports nutrition and healthy lifestyle at Lincoln University, Malaysia. Her primary motivation is to promote healthy nutrition and other lifestyle pillars in order to reverse the burden of non-communicable diseases that are currently plaguing societies worldwide. Dr. Koushik Reddy is an interventional cardiologist at the James A. Haley VA Medical Center in Tampa, Florida, and serves as the Director of Interventional Cardiology and the Coronary Care Unit. He was the first interventional cardiologist to be board certified in lifestyle medicine and is currently the only cardiologist and one among only 14 physicians with the distinct honor of being a certified lifestyle medicine intensivist. In 2018, he established 2 first-of-their-kind lifestyle medicine clinics at the Tampa VA Hospital. He also started advanced lifestyle medicine educational modules for internal medicine residency and cardiology fellowship programs at the University of South Florida. He has published many papers and presented lectures on lifestyle medicine and cardiovascular diseases. Since 2017, he has been actively involved in ACLM leadership roles and in advancing the idea of health promotion and disease prevention through lifestyle medicine, and he's the founding co-chair of the VA, DOD, and cardiology MIGS at the lifestyle ACLM. Our regular panelists, I'll abbreviate these a little bit. Dr. Robert Breakey, one of our heroes, is board certified in family medicine and lifestyle medicine, and he's also serves as the medical director for IHA's William J. Folletti Center for Lifestyle Medicine. And he's on our board of directors. And Melissa Sundermann, otherwise known as Dr. Outdoors, is board certified in internal medicine and lifestyle medicine, has been practicing medicine for over 20 years, and has transitioned to a lifestyle medicine concierge role. And I'm going to just skip over that for the sake of time. Dr. Carrie Graff is our new medical director at Rochester Lifestyle Medicine Institute. She's board certified in both family and lifestyle medicine. And you can read this later when you watch the video. And that's me. I'm board certified in lifestyle medicine as well as diagnostic and interventional radiology. And I'm the founder and president of our LMI. So now I'm going to stop sharing and we're going to turn it over to Dr. Arunie Malwatta, who will talk about a patient with persistently high pancreatic enzymes. And I'm going to disappear. And thank you so much, Dr. Malwatta. If you could start sharing your screen, please. And again, welcome to our panelists, especially our guest panelist, Dr. Koushik Reddy. So go ahead and start sharing, please.
Yes. Thank you very much for that wonderful introduction. And I'm here with my patient whom I started seeing her about 14 months ago. So she is, we will call her Mrs. M, and she was a 60-year-old and occupied with a very sedentary occupation where she had to be seated for more than 8 hours a day. And she presented to us with very depressed mood and nominating and describing herself as an anxious person. And also she had a history of clinical depression where she faced devastative conditions during her divorce, where she had to take medications and antidepressants for her symptoms 10 years back, but she was not regularly on antidepressants, and she was stable at the presentation on that, other than this depressed mood. Further, thinking about her history, she came to us for asymptomatic elevation of pancreatic enzymes, which she accidentally found during her labs, and which made her go through several of many investigations to find out why this has been really high. Other than that, she was asymptomatic with she had no abdominal pains or any kind of suggestive symptoms to think about any pancreatic pathology. So she was a hypertensive patient for last 20 years with 2 antihypertensives and some other cardiac preventive medications like atorvastatin, very high dose, 40 milligrams, and aspirin, 100 milligrams daily. So her social history, her background was, she was a divorced mother of 2 children, and at this moment she was living with her son. She has never taken or abused with any substances like alcohol, tobacco, and she was fine with that. She has no family history or any related pancreatic pathologies coming down her families. If you look at her diet, her meals were with a lot of refined carbohydrates. In fact, when calculated, it was shown that more than 50% of total carbohydrates were refined. And she was over concerned of animal protein intake, that she thinks that it is something she really should be stick to, and it is something should come in a diet. And she had some different opinion over that. And vegetable intake was very minimal and very irregular. In that scenario, she preferred fruits over vegetables. Most of the time she grabbed a fruit, but not vegetables. She had a sweet craving as a stress coping modality where she grabbed and food grazing behavior all throughout the day. When it comes to exercise, she had never practiced a structured, regular physical activities. And she enjoyed her time in front of her television every evening once she's back home after her long day of sedentary work. Her sleep was poor with quality and quantity both. She had about 3 to 4 hours sleep. There was a fantastic, very important reason for her to stay awake because her son was a shift worker who comes home after midnight, and he was opening doors and making his food. Everything was disturbing her, and with her anxious mood and her very superficial sleep hygiene techniques, she was not sleeping well. She has no regularity or quality or quantity over her sleep. I have just mentioned here her room is situated near the kitchen, and it was really disturbed all the other things going on with her son's behavior at night. When I examined her, she was 64 kilograms and height was 150 centimeters. and her body mass index was just above the normal. I mean, it's beyond the normal norms. So the waist circumference was 95, indicating that she had quite an amount of visceral fat and abdominal obesity. And her blood pressure with all these medications was only 130 by 80. It was not lower than that. So this is my lifestyle assessment over her. You can see this assessment. She was having only 19 out of the total score, and she was fine with her substance score because she scored 10 out of 10. But you can see movement, nutrition, recovery is really bad, and her other pillars of lifestyle is really at very poor level on the beginning. This is her labs at the initial state. She was having really high ALT levels, and amylase and lipase both were high. Other than that, we could not find any abnormal pathologies or any other problems with her lab reports. So we were just working on what we had, and with the available evidence, we were just trying to build her bridges and make her comfortable with our management. Can we go to the poll?
All right, so we got our first poll, and then we'll have a little discussion. So
Yeah, then here I would like to ask, what will you do if you get this patient? What will be your next step, and what will be your thoughts up to so far?
all right, I'm going to ask Dr. Reddy to comment on that, please, and what you would have chosen.
Yeah, so this is again, thank you for sharing the case. Great presentation. Looks like the woman is going through a lot. So those enzyme elevations based on history, we could usually, one of the things that I teach my students and residents is, when done the right way, by the time we are done with history, in all of medicine, not just in my specialty or subspecialty, we should have a directionality towards an etiology. What could be the possible cause that's making this patient come to me? So she does have history of depression, anxiety, the phenotype of the obesity with a very high height to waist ratio. So, and then by talking to her, not going to get, we are going to be more lean towards some kind of a psychiatry or mental health issues that we need to address through a lifestyle or a psychiatry perspective. But then you go into, we haven't gotten to the detailed exam yet, but the labs throw you off and say, whoa, what's going on here? This is not what I heard from the history. She's not complaining of abdominal pain, recent travel, no gastrointestinal symptoms, and that kind of throws you off. But then you connect back and say, hey, am I looking at some type of an advanced steatohepatitis, right? Because for her height, her BMI technically 25, 28, slightly off, but her height to waist ratio is unusually for a woman who's 150 centimeters tall to have a 95-inch waist. It's an enormous amount of visceral adiposity. So I would like to, before I counsel her into the details, there's an enormous amount of counseling to be done in terms of, sleeping habits, social construct, all of that. But those liver enzymes need to be addressed. So I would like to get to the bottom of what is the etiology so we can counsel her appropriately. So I would go with number 3.
Okay. I think you meant to say 95 centimeters, not 95 inches.
Sorry, centimeters, yeah. Centimeters.
Right. Yeah, but sure. I mean, the rule I've always heard is that your waist circumference should be less than half your body height.
Less than 0.5, yes.
Right,
Yeah.
right, great. So we've lost Dr. Breakey because of a power failure. He'll be back in a few minutes. But Dr. Sundermann, your thoughts, please.
So I chose number 2, improve her self-management and self-care through lifestyle medicine principles while looking for a diagnosis. I completely agree with Dr. Reddy. that we do have some lab abnormalities. What I appreciate about this approach from Malwatta is that this woman probably was referred to you because they're, your lifestyle medicine, but also there's some elevated liver enzymes and elevated pancreatic enzymes. And so, yes, we need to try to get to underlying root cause of that. But I think what was really effective is when you did Dr. Bonnett's lifestyle medicine assessment, and I love that it's visual. So this individual may have not realized or even thought about what the pillars are, and may have not even realized that these were even important, or even realized, where am I doing okay and where am I not doing okay? And so I think that was beautifully done, that she was able to assess herself, do self-assessment, look at those pillars. You were able to educate about those pillars and probably why they're important. And then having that visualization of, you're doing great on substance abuse, like you don't drink, you don't smoke, wonderful. But here in the nutrition or the restorative sleep, maybe not doing so great. So I think that was a wonderful approach. And I would say to continue, there's no harm, no foul. And we know through our practices that she's going to benefit through your lifestyle counseling. She's able to visualize what that means and how to make improvements, and we'll be able to track that. And I agree, we still need to decipher where the elevated liver enzymes and the elevated pancreatic enzymes are coming from and address that.
Thank you, Dr. Sundermann. I have a question as a simple country radiologist. What does it mean on that Dr. Bonnett's pie chart? What does recovery refer to?
I think that's referring to the sleep pillar.
Yeah,
Is
in
it?
general, yeah, recharge, recovery, yeah.
Yeah.
Oh, okay. It's the sleep pillar.
Yeah.
Okay. Got it.
Mhm.
Sleep and timing in nature, actually. Those questions were giving that part completed. Time
Did you
in
say-
nature,
Oh.
time in nature and sleep. We have
Okay.
questions. Because
Yeah,
this assessment tool was created by Jonathan Bonnet, and
Yeah.
I love it, and I am using it at every patient to see where they are in the beginning, and I'm amazed, and I'm being happy and very satisfied to see their progress over time through this assessment tool.
Got
Yeah.
it. Great.
I love it that he puts nature in that. That's great for
Yeah.
restoration.
Yeah, I agree with Dr. Sundermann in the sense that while we look for diagnosis, we don't, outside the context of answering a multiple choice question in real practice, all of us would say, hey, while we put your body through full body scanning or whatever is needed, just make improvements in what you can in terms of every pillar, and it makes a big difference. So they're not mutually exclusive.
Right. Okay.
Can I continue?
Yeah, please proceed.
Yeah.
Ted, hey, Ted, I may
Yeah.
back. Can I, quick comment?
Please. I'm glad
Okay,
you're there.
good. Yes,
Thank
thank you. Sorry, we had a major thunderstorm overnight. My power's out. We're on generator. If it glitches again, I got to wait for the modem to reboot. But I was listening by phone. I agree with the comments. I also picked number 2 with that sense that we need to pursue both. You can't ignore those elevated liver and pancreatic enzymes. And at the same time, concurrently to work on lifestyle approach. I guess one question on that, the kind of spider-like graph you had, I noticed that on nutrition, she scored a 5 out of 10 in spite of being high in animal protein and half of her carbs coming from refined carbs. We didn't get a lot of more detail, but she didn't like vegetables. How did that get a 50% when average American is kind of a 1 out of 10 for the standard American diet?
Yeah, I wondered the same thing. Dr. Malwatta, how did she get a 5 out of 10 for that?
Can you please ask that particular question? I was not,
Oh,
So her nutrition score was 5 out of 10 in spite of
Yes.
eating a lot of animal protein, very few vegetables, and half of her carbs were refined carbs.
Yes.
How did she score so well on that one?
Yeah, that our assessment tool focuses on type of oil use, or whether they don't use any oil, or fruits and vegetables, fruits, and refined carbs, packaged snacks. So all these questions are asked. There are 21 questions for all 5 pillars. So out of them, it generates this chart and the score. So those are the questions we ask: fruits, vegetables, refined carbs, packaged snacks, and oil. We
Okay.
give more marks if they don't use any oil, or maybe olive oil.
Okay, yeah, it'd be interesting to see what she scores on the 4-leaf score. We commonly use that in our group just to get a basic sense of where people are on kind of percent whole food plant-based. But again, so far a great overview of where she's at. We'll be interested to see what some of her diagnostic tests show next. Thank you.
Yeah,
She wouldn't do well on the 4-leaf score.
She wouldn't.
I think so. Yes, she's
she-
someone for that. Where she was a animal protein intaker and over concerned with animal protein, which I had the trouble in the initial state. So she was benefited with 4-leaf. Yes.
And I think we need to do a shout out for Dr. Carrie Graff because she's the one who developed the 4-leaf score. And it's a
Yeah.
really great tool to use in the clinic as well.
Yeah, I
Okay.
could have got that score as well.
Great, thank you. Yeah, we'll have Dr. Graff talk about that later. But thank you. Why don't you continue, please?
Yeah. These were the initial diagnoses we reached. She obviously had this advanced fatty liver disease, which is depicted with NAFLD fibrosis score, her AST/ALT levels, and ultrasound scan results. So also her psychological status with stress scale was with high scores, which were 28 and 4 respectively, and elevated enzymes of pancreatic enzymes were a problem. We couldn't poke a specific reason for that, even though we did MRI or whatever, it was not giving any clues. So we were left with these differential diagnoses, and we started our management at this level, thinking this is a whole person, and we have many different avenues to touch up and start ahead with, without waiting her everything, all the kind of the parameters to be very clear in front of us. So we started our treatment approach. Obviously, the medical management was the part. Also, we focused our 6 pillars, plus 3 additions we always wanted to have: the time in nature and purpose and the flow activities. I mean, it was really interesting when you ask about flow activities to find joy. Different people have different preferences and different flow activities for them to be happy. And it is a kind of natural prescription that when we just touch up these pillars and made up our treatment approach. So we just started all 6 pillars simultaneously, and the counseling was a big deal. We were just creating the very positive environment, and special counseling were conducted for her sleep, nutrition, stress management, and to improve her self-management and self-care, which were really important for her resilient building techniques. So a lot of science behind mindfulness-based stress reduction and stress reduction activities, little exercises, deep breathing, and relaxation techniques, time in nature were introduced. Sometimes as doctors, when you are very traditional doctors, we really don't want to speak beyond our medical professionality. And we think it's something everyone knows, and why should we just spend time to ask a person to be in nature and so on. But we were different, and we were just approaching these beautiful lifestyle principles at every step in this patient's management while parallelly we are just investigating her over her investigation abnormalities. So physical activity was something came first line because compared to her sedentary life, being seated for 8 hours, so it was a disaster. So we started very slowly activities. Initially the 10 minutes walking, which later we improved it up to the 45 minutes to 1 hour, slowly adding muscle resistant exercises head to toe and to reach the kind of guideline recommendations. So we actually replaced her television time with her walking and exercise and walking outside. So it was a good time. After her work, she was happy to take it up, and she experienced the difference by walking in between trees, and she had a beautiful area to walk around. So it was really difficult initially, but we managed to continue this management by very closely following her up and very communicating with her. So I think this telemedicine approach, what we followed with very closely following up her progress, was a secret of this management. So her office table was converted to a standing desk. That was a kind of very interesting thing, I would say, later in this presentation. So it made her colleagues to write letters to their management for asking the standing desk for them also. So I think it was a great thing. So she was just infecting other people with these good lifestyle habits. So sleep hygiene, I had to approach this very differently because her family setting, they were very close. She was waiting for son to come, and they had a very good bond in between. So I could not ask her, okay, you just look after your work, like. So then we had to very slowly understand this mother and son bond, and we had to change her room, and we had to invest good investment on recreating her bedroom, and sleep hygiene techniques, sleep restriction were applied to make her sleep better. So it was giving us good results. So the dietary restructuring was important, and it was, I would say it was difficult initially because people do not eat because they are hungry. They always eat because they like food, and they were used to be with that food. So it was very slow and very discussion based. So complex carbohydrates and refined sugars, which was her food grazing behavior throughout the day. So we had to very gradually approach that and ask her to stay away and start using real food, which is unprocessed, which directly come from the nature. So in this way, that also we encourage what I believe as a nutrition physician is every food has its own beautiful taste. What we do is we just don't entertain that taste. We just add salt, vinegar, whatever, and differentiate that taste all the time. So we just started her to learn and unlearn tasting food. We wanted her to entertain the natural taste of each food and do the natural mixing and matches a very subtle way to entertain the natural taste. So natural spices and herbs, we have a lot. So it was introduced actually with a big variety. We have a lot. Sometimes we can just think how many spices and herbs we do have. If I ask, what was the last time you used star anise in your food? So not many. So those are kind of rare spices that is being used. What was the last time you used cardamom in your food? So likewise, if you really add these spices and herbs together, so it's a wonderful mix of natural flavors. So we taught her those little skills and increased her vegetable intake in every meal. So she was a rice eater, so it was a good way of mixing and matching lot of vegetables in curried form.
Hmm.
So this is something that was very important. She was a person who had friends, but she was not having good friendships because of her low mood. So we could broad that up and we could recreate and regenerate that connections and stronger communications with her happy mood. So it was not difficult for me. So we created, then we gave suggestions for her to go out and trips and be friendly with and communicate, call people and have at least 3 people in her innermost cycle all the time. So it was making her comfortable. So with her permission, I'm sharing these pictures which was sent to me because this was her garden. She started gardening, spend more time in nature. So she just started creating her homemade food. So she used to send me whatever she is eating, the pictures and all. I'm just sharing with all her permission. So this is her garden and whatever the happy life she recreated. So I would say that managing her as a whole person was very strong message here. We were not running behind a different system. Okay, liver was bad, pancreas was bad, and it was investigated parallelly while managing her and making her happy and more strong personality from the day one. So I think this was important whenever you see a patient to start ahead with. So self-care and self-management techniques. So this is something really important which we practiced. Sorry. And all of us, including her, have gaps in our pillars. So it is always important to revisit and find the gaps and compare the good days with the bad days and just learn from our bad days for them to be converted into good days. Why that has happened? So these gaps in different pillars. So always if you just keep your 6 pillars in front of you every day, so it makes you really glow and flourish. So this was the care plan again. So while managing her as a whole person.
So,
So-
Dr. Malwatta, can we take time for comments
Yeah, sure.
from the panelists? Dr. Reddy, you have any comments at this point?
So far, I think the management was beautifully done. You really, addressed as like a total, kind of like a more of a human connection, trying to, adjust the room, where she sleeps, getting her desk at her workspace. So kind of really, truly changed the lifestyle within the construct of our current dwelling and workplace, and added gradual incremental doses of physical activities, stress reduction, to a point where she's growing her own garden, a beautiful tropical paradise. And assuming that this is obviously in Sri Lanka, since you asked the question how many spices we have, it is with a lot of pride. I always say this, people who come from that part of the world, including myself, the answer is that we have more spices than there are stars in the galaxy.
Okay,
Beat
that's a
that.
lot.
So there's no problem in making a healthy, whole food, plant-based diet,
Mm.
the Indian or Sri Lankan style. It comes out amazing.
Thanks for that. Dr. Sundermann.
Well, first off, I want to applaud both of you, Dr. Malwatta and your patient, because this was incredible to see the progress through every single pillar. And she's nailing this. This is really incredible. And I agree with Dr. Reddy. I love how this was whole person and this was so personalized and allowing her to realize that it sounds cliche, that self-care is not selfish. And, she lives with her son. She's always a mother. So she's waiting up for her son to get home and all of these things. And sort of examining her behaviors of I work all day, I come home and relax. And relaxing to me is watching TV and reframing that relaxation could be something different. It could be going for a walk. And I also find it really beneficial when we're educating our patients about behavior change, and the pillars of lifestyle medicine is the why that goes beyond fitting into a different, size pants or losing weight or sleeping better, of as you are optimizing your nutrition plan, educating a little bit about the gut microbiome and say, do you realize that 90% of your serotonin, your happy hormone, is produced in the gut microbiome? And as you are eating the rainbow, you are optimizing that. And I know in the past you've struggled with anxiety or depression at various times of your life, and food and mood are intricately connected. And as you're optimizing your gut microbiome, you're optimizing your mood as well. And similarly to exercise and optimizing her body composition. And I have the ability to use an in-body exam, and in the past had a DEXA, so we could look at visceral fat and educating what that, and that can affect insulin resistance. And she may have insulin resistance because she had the fatty liver. That's one of the things that we were thinking was going on. And every time you're moving your body, you're generating BDNF, and that's like miracle growth for your brain. So sometimes these little pearls of education and knowledge that we give to our patients can then reinforce that this goes beyond just hitting a number on the scale or fitting into a dress or something like that. It's like these benefits go far further, and just like spokes on a wheel of a revolution on your bicycle, that all of these pillars are equally important. And that's where that visual with Dr. Bonnet's assessment, she was able to see how all of her spokes in the wheel were not equal. So again, I commend you. I think you did an incredible job. You have connected with this patient. You have been able to help her. And like you said, you've empowered her. And ultimately, she did this herself with your support and encouragement.
Thank you,
Right.
Dr. Sundermann. Dr. Breakey, are you there?
Yes, well, I would, echo the importance of all, and the fact that they're not just all important, but synergistic. And the one to really see here is the sleep. When you're sleep deprived, you can't exercise, you don't feel up to thinking very well, you're stressed, you don't make good eating decisions, your comfort foods or the high carb foods are part of the consequence of that. So that was great that she could think outside the box and, hey, you need a place where you can actually have an environment that's conducive to sleep. That then I think leads to better decisions on the others, the walking, and in particular with the fatty liver, we know it's largely the diet. There's three main components to that. And first of all, as we talked about, her BMI is not as high as we commonly see with fatty liver, but people have different body types. We'll remember endomorph, ectomorph, and mesomorph. And so she's got a generally slender body, but her waist is larger. And she's one that stores visceral fat more easily, even in spite of smaller amounts. And this is that critical part that can interfere with liver function, getting into a downward spiral where as it doesn't function as well, toxins build up. And three critical components there are the animal protein, especially those high in methionine, which is pro-inflammatory and sulfur-containing, acid-forming, and high fructose corn syrup. When you say she's high in refined carbs, I picture a lot of processed foods, and that particular simple sugar is especially hard on the liver. And then the third we all know about is fiber. The liver actually is partly an excretory organ by dumping things that are in excess into the bile that then attach onto fiber and work their way out through the bowel. Estrogen is a good example. When there's excess estrogen, it puts it into the bile, attaches to fiber. But if there isn't enough fiber, it reabsorbs and the liver has to do it all over again. So the example of many of these substances where the liver is doing the job twice, sort of like a dysfunctioning heart valve that has to pump the valve twice, pump the same blood twice. So by improving her diet to decrease the simple carbs, eat more plants, vegetables, phytonutrients, she's really helping to reverse this fatty liver disease. It's commonly reversible, but it does need care. So once again, thank you for bringing this very fascinating case for us. And I think that indirectly, we didn't see a pancreatic tumor, overt pancreatitis. Her pancreatic enzymes are above usual, likely as a result of this metabolic stress, fatty liver and other. I don't know if you're going to finish off with a little more answer to that for us or not, but that turned out to be a little bit of a blind avenue because we haven't found any major pancreatic problems, but I think it's part and parcel of the same metabolic syndrome imbalance that she's experienced.
Can I ask a quick question to our cardiologist? She is on atorvastatin 40 milligrams. Dr. Reddy, how often, I haven't had a case of this, but you see a lot more patients on statins. Could it cause elevation of amylase and lipase being on a statin? Do you ever see it?
No, I have not seen that. I have not. Seen
I mean,
it.
it's
Is-
listed as a possible adverse effect. I just
It
haven't
is.
seen it
It
clinically.
is. Yeah, and I've seen gardeners in 30 years of being in, in this field. I've seen the combination, but where we were not able to attribute that to the being on a statin. And also another thing is that she has not had an event, since we brought up cardiology, the need for aspirin, probably not for primary prevention anymore. But one other comment I actually wanted to add for the audience, some of you who may be new to the practice of lifestyle medicine, you probably heard, meeting the patients where they are at. This is how it looks like. This is like a true example of meeting our patients in a non-judgmental way, where they are. Easier said than done. When the rubber hits the road, it is hard because there are many barriers. But this case beautifully illustrates how when you take kind of, little nudging here, little nudging there, calling the office, that kind of stuff, and it can be done, but takes an enormous amount of purpose and passion-driven people. And I'm happy to hear that it's being done.
And then
Right,
one
yeah.
question for our resident radiologist, Dr. Barnett. So an MRI was done. Will that, so if there was any kind of cholecystectomy, would the MRI pick that up like a stone, or do you need to do an MRCP to pick up any kind of stone that maybe could be causing the elevation of the
Right. So I'm
amylase
not,
lipase?
yeah, I would think you need an MRCP generally.
Okay.
But I don't consider myself actually, I'm embarrassed to say I'm not an expert on MRI. It's one of my, I don't actually read MRs, but
Well, you're
I
more
mean,
of an expert than I am.
right. I mean, I've certainly looked at MRCPs, MR pancreatography, and that's, looking for stones. I've definitely seen this, but I actually don't know the answer what the odds are of finding one if you don't do the MRCP. Ultrasound is, going to be the best. That's what we routinely do. I mean, you can miss them on CT for sure. So, all right, back to you, Dr. Malwatta. We got to pick up the pace a little bit here.
Thank you.
Sure.
Yes.
But this is a great conversation.
So,
Thank you.
this was the care plan. So I have already discussed this. We were stick to our 6 pillars, and we were continuously following her up very closely with close communications through telemedicine. And we were reviewing her weekly. Challenge were discussed. We just open up avenues for her to reach us and just bring us whatever the challenges she faced. So likewise, we were managing. So you can see that I have added here that limiting fats and carbohydrates was done. So, but this was long ago I managed this patient, but after learning from Jumpstart, my knowledge span really changes, and now I know that we don't have to fear for carbs, and it's always when it's the whole carbs, we are comfortable with many other ways of managing these kind of patients. So, but according to the evidence-based medicine, what we should be doing at this stage was to reduce calories and lose weight for her fatty liver. So this is what we practiced at that point. So further explaining what happened. So the So it's the skill base and behavior change all throughout. And we were, as providers, we were more curious, clear, and we were sustaining our attention towards her. So she became more empowered, and she became a kind of, I would say, like a brand ambassador. That, I mean, she was telling and preaching her friends and people around her. So a vast difference in her. They were asking, how did you lose weight? What's the difference with you? So these kind of conversations made her really happy. Actually, I would say that her life was totally changed from darkness to clarity. So I'm so happy. But I should say that we could not come off the medications, and we were just reducing them because of our system. I mean, the caretakers were not happy to stop medications totally, although we came down with the doses. So after a while, after about 8 months, this is where she was. So she was fine with substances even earlier. Her movement scale really came up, and nutrition, she was just following the best nutrition practices. She was not taking any processed food, and the recovery part we are still working on because it was really, really low. It was at 0. So we could not achieve the total benefits through that, but we are somewhere there and we are still working on it. So this is the comparison where we came up in the lifestyle score ladder. So you can see the difference. So if I just came to my labs, so these are the labs, you can see the amylase and lipase levels are still high. So this is the reality. So we are still looking for the cause, and we did not find the exact cause for this high amylase and lipase. All her MRI and all her reports were normal. She was asymptomatic. So this is a kind of accidental finding, and I don't know, it's still somewhere in the above the upper level. So her liver scan came completely normal, and all her fatty liver parameters went down to normal. So this is my next poll.
Good questions. Wow. All right. Let's try to fill this out.
Wow.
Interesting. All right. Dr. Reddy.
So this is very nicely, you put a lot of thought into how you worded these multiple choice questions, and I agree with Dr. Barnett that you're a tough board exam question writer. But I want to kind of connect, in my own type of doing this to my patients, I break the word healthy into heal thyself. Right?
Wow.
The very word, literally, actually in English you can do that, but where I come from, the root of language swasth is the Sanskrit word for health. It is less literally the translation of inner being. So, and that kind of connects with your first question, the way you phrased it, and I chose 3, others chose 2, but ultimately it is not a separate silo, that famous example of an elephant and everybody seeing the tail, somebody seeing the tusk, somebody seeing the ears, but nobody sees the elephant. But that's the beauty of lifestyle medicine, or whole person health, which is now almost like should become a healthcare motto, and that's what was done here. And yes, some of her enzymes are high, but some of her, body weight is still high. She still has slightly elevated blood pressure. But look at the way she's feeling about herself, about sense of well-being, sense of purpose, sense of connectedness, sense of mobility. And I kind of, the way you beautifully phrased this multiple choice question by saying that, incorporating the WHO definition of not just the mere absence of health, but the presence of, physical, social, and you can even add emotional and spiritual health, which I think worked for her. And hence she healed herself. So yeah, thank you. And I applaud you and your patient, as we heard from Dr. Sundermann, for this excellent work. This is very impressive, true kind of compassionate care.
Nicely said. Yeah. Dr. Sundermann.
So again, yes, congratulations to both you and your patient. And I loved her quote that she was feeling more curious, right? She wanted to learn. And that's what we really inspire as people are regaining their health, regaining themselves. We, as physicians, we want to help guide them, maybe educate them, but ultimately this is a partnership, and it works out best when you partner, and you clearly have done this with this patient because you met her where she was at. You gave her tools that she was able to implement, obviously used SMART goals because she was successful. And then as she became more successful, she became more curious about how I could do this, what am I doing? And then became a role model, right? Because other people saw what she was doing and they're like, I want to do what she's doing. I want to have what she's having. And that is just full circle of, positive feedback to her of, my gosh, like people are noticing. And again, we want to be lighthouses, right? And I think as lifestyle medicine practitioners, no one's perfect, but we do our best to practice what we preach and walk the walk. And when other people see that we live lives of vitality and that our health parameters, according to the World Health Organization, we have hopefully met these, that other people are like, that seems to be working. I want to learn how to do that. So congratulations to you and your patient, because now you are influencing the ripple effect so many other individuals.
Great. All right. Dr. Breakey, you still there?
Yes, thank you. Yeah, great. Like people have said, I love how you phrase these questions, and so many teaching points here. Number one, we don't just chase lab results. We look at overall how the person's doing. There are many examples of where labs are outside the reference range, but even better than normal. For example, a person with a low whites count on a whole food plant-based diet has low levels of inflammation. The lab is, quote, abnormal, but it's actually healthy abnormal. And other examples where being normal American high cholesterol is not optimal. So we can't just watch labs, and we have to be careful of that one. The amylase and lipase could be related to any number of meds, even though something's not commonly reported. We have to know that meds can have different effects in different people, depending on their microbiome, their genetics, their environment. There are so many factors. So we have to always keep in mind that meds could be there. And then, as someone pointed out in the chat, hypertension is not really a disease, it's a condition caused by endothelial damage, lack of nitrates, the inflammation, and atherosclerotic plaque. So absolutely reversible, just like obesity, most cases of type 2 diabetes in the early stages, and coronary artery disease. We have to think of those. And again, in number 4, especially great that you've pointed out that positivity, which is glowing in her, and which again is now, as Melissa said, becoming a beacon for others. And that's how we spread this message of hope, of health, of positive wellness, by people not just telling people what to do, like, don't eat that chicken, it's going to kill you, but rather, I choose not to, and look how well I'm doing. That's what attracts people and spreads the word about this life-saving approach to healthcare. So thank you for pointing out all those great attributes in this one awesome case. She's fortunate to have you as her doctor.
Yeah, this is my last slide. So I would say that she successfully lost 10% of weight. Now her weight is 53, which is 11 kilos less than what she was initially. And she totally overcame her fatty liver. And she totally became a different person. So I believe I restored her health towards the betterment. And I think her pancreatic enzymes issue, maybe she's lying in the 2.5% in the Gaussian curve. So I don't know, but it's still under the investigation. So sometimes we worry too much over some little things. I mean, ignoring the elephant in the room. So I believe I was so happy that this patient overcame so many of her troubles, and I would have still some concerns over her high levels of enzymes, and still we are investigating her. And our next step is to totally come down and take away her medications and see whether that would do any benefit over her.
Yeah, you can
Thank you.
definitely take her off of these medications, especially they're all in my type of a realm of clinical practice. You know, a whole food plant-based diet. She's
Yes.
intent of treatment is primary prevention. She never had a cardiovascular event. There's no need for aspirin. And like we heard before, majority of patients, even after many years of being on multiple antihypertensives, we know this, in a compliant patient with moderate salt reduction and a plant predominant diet, blood pressure comes down on an average of 22 millimeters after 30 days of compliance.
Hmm.
And
Fantastic. Yeah.
yeah,
But
yeah.
it was difficult, I mean, in the practical setting, when we work with different specialties, then we have lack of patient-centered care, sometimes it is not really easy. I
Mhm.
mean,
But you accomplished it, you and your patient, with all the limitations. This is kudos to you and her. Awesome.
yeah.
Right. No, thank you so much. We are going to take a quick break, but we're going to come back and we're going to move into the lobby because I think this conversation is worth another 5 or 10 minutes.
Yes.
So if you could please stop sharing. I just need to
Yeah,
share my
sure.
screen for a moment here. If you've been through this and you would like to get a CME, sometime later this evening, you will be receiving an email with a link to a Google form, and you fill out the survey there, and you will receive in your email box a certificate worth one CME, and we're so grateful that we're able to do that for people because of a very generous donor. Also, we'd love it if you could donate to our work. My wife and I are full-time volunteers with our LMI, but we do pay our staff, and we do have significant staff and significant expenses. So we'd love it if you could help out as much as possible. So Dr. Graff, do we have any questions in the chat that we'd like our panelists to discuss?
It's just one question about your communication, Dr. Malwatta. So you said that you used WhatsApp. Is that a HIPAA compliant? Are you able to do it HIPAA compliant wise?
In Sri Lanka, we do, because we have no other way. We don't have EMR, and we can't compare this system back home. So we use our different ways of communication. It's practical over there. We have patient groups in WhatsApps, and sometimes, yes.
Okay, thank you.
Yes.
There was a question in the chat about fatty liver disease treatment. Would any of our panelists like to discuss the treatment of fatty liver disease?
I will share a couple of experiences, but that may connect two things. Again, I say this with the guy being in the deep silos of a subspecialty within a specialty. So that's where I live. But I do this with the eye of a cardiologist, and most of my patients, if not all of my patients, are cardiac patients. But one thing that I've noticed within 6 months to a year after kind of getting deep into practicing lifestyle medicine, how frequently I started psychologist, psychiatrist, and hepatologist and a nephrologist started tagging me on the same patient's notes, because the same patients have mood disorder, same patients have obesity-related liver disease. And they would notice that they would go to the psychiatrist and say their mood got better because we just changed their diet from a purely cardiovascular perspective. I'm not even thinking, I know the connection, but I'm not the expert in the field of psychiatry and mood disorders. Neither I'm as expert in hepatology and nephrology. So, but those patients would come back, and there were a few patients where patients' spouses did the exact same thing, were actually taken off of liver transplant list for FibroScan got so improved that they were taken off the list. They were not even my patients, but they were doing along with the side of the patients. One was a sister of the patient, other was a daughter of the patient, and they were their support system. And similarly, and another connection with this patient here that we had just heard of, is the amount of psychological burden and anxiety burden that she carried, be it from a prior relationship and the divorce and caring for the son and all, late nights and all of that. And they do get better with a combination of, comprehensive approach. But in terms of, very in a reductive way of saying this from an approach point of view, there's a direct correlation in terms of fatty liver, calorie per calorie. Saturated fat has more influence, more deleterious from a fatty liver perspective. This is extremely well studied, calorie per calorie. And by going on a plant-based diet, you enormously decrease the amount of saturated fat and then the total caloric intake, and then you lose weight. And unless it is in a very advanced stage, I have seen impressive results. Although those are the side benefits. I'm looking for heart failure, AFib, hypertension, stroke prevention. That's my kind of focus. But these are the side benefits I've seen in many patients.
Well, and
Yeah.
it seems that, we have our statistics that 1 in 3 Americans now are living with prediabetes, right? And don't even know it. And now we have a new name for fatty liver, MASLD, metabolic associated
You're not
steatoic liver disease.
Yeah.
And about a third of population could be living with MASLD. So again, these are diseases of lifestyles, right? And the more that we can educate about that, this is preventable. And I think for so long, people thought that, alcohol was how you had liver disease. And now we know that MASLD is like one of the largest contributors to liver failure and to ending up, with cirrhosis. So I think continue to use our voices to educate that so many of these diseases are lifestyle related, because we're going to keep seeing more and more. It's going to be commonplace to have these diseases if we don't get more of us out there.
Yeah,
Yeah.
I would agree. The liver is one of the most able to regenerate. I mean, it can even regrow parts of itself if lost. And similarly, when it's at the inflammation stage, fatty liver stage, and until you get to cirrhosis, which is obviously a scar and much less reversible, it can commonly be reversed. And the way I help patients is to understand that the main concerns are the meat-sweet diet. The meat, which is high in animal proteins, pro-inflammatory, especially the high sulfur containing, and the saturated fat, which, as Dr. Reddy pointed out, is the most pro-inflammatory. And the liver is responsible for detoxifying. That's why it's got first pass on foods. That's why, and when it gets overwhelmed with excess fat in the bloodstream from diet, the average American is 35% of the calories from fat, and ideal is more like 10. Especially saturated fat. It's kind of absurd that the dietary guidelines say up to 10% of calories can come from saturated fat. It is hugely inflammatory, atherogenic, insulin inhibiting, increased insulin resistance. So we are in an environment where our diet almost couldn't be better designed for diabetes, obesity, fatty liver disease. And conversely, reversing that to a normal human diet, which is about 80% carbs, 10% protein, 10% fat in the form of whole foods. I hesitate to talk so much macronutrients because we don't eat protein, fat, carbs, we eat food. But naturally, these foods contain the right balance of anti-inflammatory, phytonutrients, antioxidants, and the lack of saturated fat and high fructose corn syrup can help people to reverse the fatty liver. So, yes, this is a critical case. And as Melissa said, it's kind of slowly becoming the silent epidemic of the 21st century.
Yeah.
Heart Association does say that's one exception in terms of guidelines for saturated fat. Heart Association does say keep it less than 6%. And in terms of the macros, the way I communicate with my patients, because they're looking at apps and their ratios, and I said, ask yourself a very simple question. When was the last time you went into the public, a grocery store and picked up the phone, called your spouse and said, honey, I'm picking 8 fats, 9 carbs, and 7 proteins. What's for dinner? Does anybody think about food like that? Don't, right? So don't leave that to the biologists, leave that to the nutrition researchers that are doing bench research at NIH. But when it comes to your plate, think of food, whole food. Yeah.
I love that, Dr. Reddy. And as I'm just reflecting on this case, and really what we want to preach is abundance, right? When we're talking about transitioning to a whole food plant-based and educating about how abundant all of the plants are and herbs and spices. It's abundant. And her life has become abundant, right? Her life was very small of working all day, being sedentary, going home and sitting in front of the TV and being depressed and being anxious and not moving her body. And then her abundance is now she's discovering these new foods. She's moving her body. She's growing a garden. She is connecting with friends. She's planning a trip. So I think that when I'm counseling patients, we know that restriction does not work, right? People who feel restricted, our natural behaviors, if we told we can't have something or we can't do something, after a couple of weeks, we're going to do it and we're going to go overboard. But if we shift that to abundance, and her life has just grown and she is like flourishing, I think that can be really powerful. And that's what as I'm reflecting on what you've been able to do with her, is that she's living an abundant life now.
Yeah, one of the multiple choice questions should have been if the audience could name all the vegetables on the screen.
Great question. Yeah. So as the moderator, ordinarily I would end this conversation right now because you guys have done such a great job. But we have an embarrassment of riches here, and Dr. Michael Clapper has put a point in the chat which I don't believe we can ignore because it has to do with managing this patient. And Dr. Clapper says carcinoma of the pancreas can present with depression, which this patient did have. If this woman still has elevated enzymes in 3 to 6 months, a further search for a pancreatic lesion or ductal stone should be done. And then Dr. Graff has agreed. Dr. Clapper, do you want to comment further on that, please?
Well, I'm uneasy. Hi, everybody. Great presentation, and well done. Learned a bunch. Once again, the pillars rise to ascendancy here, and how powerful they are. It's wonderful to see. But I'm still uneasy about her elevated lipase, and that's I guess it can go up as part of a liver enzyme pattern, but I'm not 100% sure this woman does not have some tiny lesions nestled away in the bulk of her pancreas there that might be presenting with these pretty much similar symptoms. So I just wouldn't put a case closed stamp in our heads on this case here. I would definitely want to see this woman, as Dr. Graff said, within 60 days, a couple of months, repeat these enzymes. And if they're still stubbornly up, I think we owe her a further investigation to make sure that there is no occult lesion anywhere, either a stone blocking the pancreatic duct or an actual neoplasm in the head of her pancreas.
Yeah,
Especially because we're going to assume that her weight loss is due to her healthier habits, which it probably is, but you're going to miss this other sign that she's got pancreatic cancer, and you've got to catch it early if you've got any chance of a cure. So you really don't want to miss that one.
Dr. Clapper, thank you for bringing it up, and Dr. Graff, thanks for seconding that. But I don't know which professor of mine, it's kind of stuck in my head. Every time I hear elevated pancreatic enzymes and depression, I think of Sigmund Freud. He wrote his thesis, entire research, while suffering from pancreatic cancer pain.
Yeah.
Refused to take medications to describe the pain of human emotions and all the work he did. And that was kind of nailed into my head. And that's kind of one of the primary reasons I didn't go into the details in the interest of time when I chose number 2 as the diagnosis before lifestyle. If somebody pushed me why, and that would have been my answer, is that I want to exclude pancreatic cancer. Because I heard that connection. By no means I'm going to pretend as an expert in pancreatic cancer completely above the diaphragm from there. That's where I live. But it's one of those things that kind of etched into my memory when I was a young medical student, is when you hear depression and, liver, coming to pancreatic abnormality, think of possibility of pancreatic cancer.
Yeah, that's why I brought that up. And nowadays, like back when I was training in early practice, we had to do an ERCP, right? Where we actually had to do an invasive. But now with the ability to do MRCP, it's probably worth doing that test.
She may need a brush biopsy of the ampoule of water.
But I guess with the ERCP, you would be able to do that.
That's what she may need because it may be the early stage. It may not be detectable as a mass except for a brush biopsy of one of the ducts.
And then, you could always look at markers too, CA19-9. I mean, if your suspicion was going up.
CA19-9 was normal, actually. I couldn't
normal?
tell.
Okay.
Yeah, CEA and CA19-9 and all these possible marker parameters are done and those were excluded.
Yeah, and then I do the gallery test too, which looks for, can detect very early stage cancer. So that might be an option too.
Wow, fascinating. Anybody have any final words before we adjourn for tonight? All right, well, listen, Dr. Malwatta, excellent job. We applaud you.
Thank you.
Fantastic. Thank you so much.
Good
Dr.
talk.
Koushik Reddy, we really appreciate your joining us with your with
Thanks
your
for having
expertise.
me. It's a great chat, great conversation. Thanks for having me.
Oh, so good to have you. Dr. Melissa Sundermann, Dr. Robert Breakey, Kerry Graff, our new medical director, and Case Wrangler, and Dr. Michael Clapper. Thank you so much for joining this conversation at the end. We love it. So until we see you all next month, have a good night. And thank you, Bob Frankie in the background here, who is our crack engineer. Thank
And
you.
thank you, Chad.
Yeah, my pleasure.
Dad.
Oh,
Yeah, Chad.
Can't give hearts with mine, just a regular one.
Good night, everyone.
Right.
Bye-bye.